seen a number of variants over the last 3 years now, starting with the first one, the Alpha variant, and then all the way to Omicron, and its children and grandchildren, if you like, is what we're kind of seeing the next generations. So the key is that to prepare us is constant vigilance and monitoring. And for that, we are better equipped than before. We have surveillance systems in place, wastewater surveillance from which we can derive analysis about variants and their proportions, as well as the genomics platform where we analyze the genome of these viruses. And that's not just in Canada, but globally, there's increased capacity to monitor changes in the virus. So that is good. And then in terms of the reactions, studying the outcomes of these variants is very important. Just because you detected a genetic change, doesn't mean that it causes any different clinical manifestations. So that's another thing we have to learn, is rapidly determine if it causes more severe illness. And we've demonstrated that globally and within Canada, we've done better in terms of trying to link that. But I think we still need some improvements on linking laboratory and clinical data. People are just fed up with, COVID-19, full stop. And yet the virus hasn't left us. And we've had to keep updating our vaccine recommendations, as well as updating the vaccines themselves. And so that's understandable, but I think we need to provide information in a as accessible way as possible to people to explain why vaccines are needed, but also I think engage trusted voices, community leaders, people that different communities trust in order to increase uptake. This isn't our only winter and our only respiratory virus season with these viruses. It would be expected to get influenza and RSV, but the problem is we're getting them all at once after 2 to 3 years of not having these viruses circulating. So it is slightly special, but we're going to be going through this again and again in the years to come. We've just had these new tools. People need to develop these personal habits. And it's I think on the ground with the other chief medical officers is you've got to get the balance of not actually doing the opposite, which is when the public is so fed up that they're offside with your messaging. So I still think that that's another pandemic lessons learned, is that when it comes to important time periods, collectively we can make a difference. We can write our own story as to what happens post holiday season. If we took these measures, we will come out of this next couple of weeks and more safely.